If you do not have health insurance, it's very tough to have your cancer treated effectively. Cancer treatment is so expensive. It's way cheaper to help people learn healthier lifestyles than to pay for very complex cancer treatment. Cancer is a major health problem in the United States. It accounts for like 20% of our healthcare costs and lots of suffering and premature death, about 600,000 deaths from cancer per year. The most prevalent cancers in the United States are lung, colorectal, prostate, pancreatic, breast cancer. Those make up the majority of cancer diagnosis. Since 1991, we've seen cancer death rates decrease by approximately 32%, which is fantastic. Those death rates haven't decreased equally for all populations.
Certainly, an individual's ethnic makeup from a genetic perspective can influence their risk factors as it relates to certain disease states. The same holds true from a socioeconomic status.
We know that patients from minority groups are overrepresented in lower socioeconomic classes, and we know that there are specific cancer risks that may be higher in those minority groups.
We assume that the most important influence on our health is doctors and the healthcare system. But that's not the case. The most important influence on our health is what's usually called social determinants of health. The quality of our housing, our level of education, whether we have healthy food available, whether we have food at all on a regular basis to eat. These are the issues that most affect people's health.
We talk about the issue of food deserts and not having adequate or appropriate nutrition available to them to serve their needs. And so they may eat a more calorie-dense diet, which puts them at risk.
They could also be living near refineries, near sources of pollution that could expose them to these carcinogens.
Access is not just the convenience of the doctor's office. Access is affordability. Can I afford the care? Do I have to make a decision between feeding my kids or getting care for the cancer that I have as a parent that was just diagnosed? And more than a few parents actually either quit treatment or don't take it in the first place because of the financial implications. Fear of the impact on the family, fear of financial distress, fear of losing your job. These are big deals, and they cause a great deal of emotional distress.
The COVID epidemic brought to light a number of the challenges with the healthcare system in general.
Millions of cancer screenings were delayed. So that's actually a big push of the American Cancer Society. We have a Get Screened campaign. We're working aggressively with partners and community members to try to get people back in there to get screened because screening is critical.
The inability to obtain screening services at recommended frequencies will place an individual at greater risk.
This is why a lot of the cancer screening programs start at a specific age and are recommended for people even who are healthy and have a standard risk for cancer.
To the degree that you're able to recognize a condition early, it provides you that much greater an opportunity to prevent it from becoming a major catastrophic problem later on.
Think, for example, getting mammography at the recommended age and with the recommended frequency can lead to detecting a breast cancer at an earlier stage that can lead to maybe more limited surgery, more limited systemic therapy, and result in a very high chance of cure.
I think it's important that we look at the delivery of primary care as an investment in the care of patients.
Primary care physicians are really instrumental in the prevention, detection, and management of cancer. They are the physicians who see those patients and first advise on the healthy lifestyle. Quit smoking, eat healthy, exercise, simple but very powerful lifestyle modifications that can decrease the risk of cancer.
You may not stop the disease from occurring in totality, but you can certainly flatten the curve as it relates to it and ideally prevent it from extending on to requiring more invasive type therapy.
They're going to order that colonoscopy or that mammogram. And then when that cancer is diagnosed, they're the ones usually who share the news with the patient and refer them to the specialized centers that can actually provide them with multidisciplinary care and have a dedicated team of physicians to work with the primary care physician towards maintaining the health of the patient. We need that blood pressure controlled, we need that diabetes controlled, we need the cholesterol controlled, because we need the patient's body to be as healthy as possible to receive those potentially life-saving treatments.
The management of oncology and cancer is now showing great improvement. People are living longer as a result of appropriate treatment and treatment options. The ability to manage the various aspects of their lives in a team approach has been shown to be quite effective and quite efficient.
Some cancer centers that I've studied create an all-day, a full-day appointment for the patient and any family members that the patient wants. And one by one, members of the care team come in to have a discussion with the patient and family members, to get to know them, to get to know what matters to them. Meeting the team, having your questions answered, and having your voice heard is so meaningful. It's such a huge part of excellent health care. We need to prepare to help our patients, not just on the physical part of disease, but the emotional part.
Supporting people from a psychosocial perspective, I think, is critical. Regardless of the disease state, always offering your patients and individuals hope that with time comes options, and with that time and the options comes cures.
If we could invest in what we already know works, we could have a really incredible outcome for patients, because we have programs that work.
Getting ahead of the curve and investing in that front end piece where it's okay, can we now prevent this from becoming a problem later on, I think is something we need to do.